As at March 16 this year, cases of COVID-19 have been reported in 151 countries. In Nigeria, there have been 12 confirmed cases with 1 death recorded so far. There is yet no confirmed case of coronavirus in Delta State. However, we have taken the following proactive steps to prevent the spread of the disease and stop transmission if it occurs. 1. The state government has already established a purpose-built and well-equipped isolation center at the Federal Medical Center in Asaba to handle any emergency. We have embarked on training of healthcare personnel to work at the isolation ward. Training and engagement of 129 Red Cross workers across the state is ongoing. Identified and established holding rooms in all zonal and state hospitals across the state has been done. Training of 5 members of the rapid response team in each local government area has been carried out. Training of laboratory scientists on sample collection and arrival cards have been distributed to be completed by all inbound passengers and crew in 2 airports at Warri and Asaba and 3 seaports in Warri, Koko, and Saple. All passengers arriving at Asaba Airport are already subjected to temperature measurement. All incoming sea vessels are to observe 14-day quarantine period to be cleared by the port head personnel before berthing in any seaport in Delta State. We are also assisting in the local production of alcohol-based hand sanitizers. The Ministries of Health and Information have been mandated to intensify public enlightenment campaigns to inform and sensitize the public on safety protocols regarding COVID-19. Fellow Deltans, while this government will spare no effort or resources to ensure the health, safety, and protection of citizens, it is important for us to know that observing proper hygiene and World Health Organization mandated safety protocols remain the best way to protect ourselves and to stop the spread of this virus. Some important facts about COVID-19. There is currently no cure for the disease. The virus is believed to spread mainly by person-to-person contact and also through contacts with surfaces where persons infected have possibly coughed into. It can be transmitted through handshakes. It can also spread through coughing and sneezing by carrier of the virus. The droplets can fall on mouths and noses of people around or possibly be inhaled if they are staying very close to you. How to protect yourself? The best way to protect this virus is to avoid being exposed to it. Avoid close contact with people who are sick or appear to be sick. Practice safe distancing. Avoid handshakes. Maintain about 5 feet distance when talking with people. Wash your hands thoroughly with soap and water for 20 seconds after you leave the office, workshop, market, buses and taxis, motorbikes, and public gathering of any sort. Do the same after blowing your nose, coughing, or sneezing. If water and soap are not readily available, use an alcohol-based sanitizer. When you cough, cover your mouth with a clean disposable tissue or with your bent elbow. If you have cough or high temperature, stay away from others as much as possible. Very importantly, avoid touching your nose, eyes, and mouth with unwashed hands. General appeal. I want to appeal to all of us to remain calm and vigilant. We must not panic. We can easily overcome this threat if we abide by the above measures and all other information from the National Center for Disease Control. We will easily defeat the spread of this virus if everyone sees himself or herself as a potential carrier who does not want to spread the virus. To adopt a superstitious approach, as many of us do, that it is not my portion, could prove to be fatal. This is no time for self-medication. If you notice at any point in time that you have fever, do not hesitate to call on the relevant authorities or visit the nearest hospital. Henceforth, I wish to direct as follows. All primary, secondary and tertiary institutions, both private and public, are to be closed effective Thursday, March 26th, 2020 for 30 days in the first instance. This will be reviewed thereafter. Parents should endeavor to provide hand sanitizers for their children. Hand wash stations must be provided at easily identifiable points in the market. The leaders of the various market associations to please take note. Offices must ensure that they are fitted with the right types of sanitizers. Supermarkets, malls, churches, and other places of worship should provide hand sanitizers for customers and worshippers. Finally, I wish to emphasize that we shall overcome this threat. We must take precautions, yes, but panic, no. We are carefully monitoring developments around the country and the state, and we update Deltans accordingly, and where necessary, more drastic actions will be taken in due course. I advise all Deltans to desist from publishing unverified information capable of causing panic and fear, especially on the social media. At this point, what we must fear most is the spread of false information, not even the virus itself. Infodemic is a greater danger than the pandemic. Deltans are therefore advised to get information from only official channels. These are the numbers to call in the case of emergency for now. Other numbers will be added to it as soon as possible. 08030758179. That is the number of the state epidemiologist. 2. 08035078541. The number of the State Disease Surveillance and Notification Officer. 08033521961. The number of the State Incident Manager. 09065031241. The number of the State Health Educator. I want to thank all Deltans at this moment and urge that we be calm and that please, we must practice social distancing. This is not the time to shake hands. This is not the time to stay very close to people. You can talk to people at a distance. And obviously, as we monitor the effects of the virus or the spread of the virus within the country, if the need does arise, further decisions will be taken in the next few days. Thank you and God bless you.